So Medicare for All is continuing to dominate the conversation around healthcare going into 2020. In fact, a lot of different politicians who are running for the Democratic nomination have some plan that has the word Medicare in it, even though it's not actually Medicare for all. So there's a lot of opposition to it as well from health insurance industry, lobbyists, drug companies. But now, according to The Intercept, we find out who the biggest foe is in relation to creating a real healthcare system that ensures everyone. So now, turns out that it's the hospitals themselves. Investor owned hospitals, according to The Intercept, are leading the fight against single payer national health insurance system, according to corporate filings reviewed by MapLight and The Intercept working together. So now, one of those big healthcare companies, I'm sorry, not healthcare companies, but hospital chains, is Tenet Healthcare. It is the third largest investor owned operator of hospitals and has donated about $630,000 to the Partnership for America's Healthcare Future. Now, what is that? Well, the Partnership for America's Healthcare Future, or PAHCF, is a dark money organization created last year in order to erode public support for single payer healthcare. So now their incorporation records list lobbyists for the Federation of American Hospitals, which is a trade organization that represents Tenet and other investor owned hospitals, as one of its authorized representatives. So again, these aren't public hospitals, but public hospitals, um, or I should say not for profit hospitals, actually also have a lot of problems as well. But these are strictly for profit hospitals. And so when it comes to for profit, well, what's the thing that they want most? The investors do. They want a return on investment. So there's that. Um, Sometimes they do that, of course, by getting a wing named after them. And so they donate and they get a wing, and then they get some PR, maybe a tax write off, or they might get some money from it, some profit from that hospital. So now, I didn't realize actually before going into the story that it was the hospital industry that has been fighting so hard against single payer. You would think the leaders would be, lobbyists from big pharma, health insurance companies, which, by the way, are still putting a massive amount of money to fight against Medicare for all. But according to corporate records, these for profit hospital chains have been integral in drumming up opposition to any kind of major healthcare reform that involves single payer or the elimination of private insurance. So now, in August, the liberal politics and policy magazine American Prospect wrote the Democrats proposing healthcare reforms, quote, lack the courage to name the one major obstacle to getting any meaningful reform done. The hospitals and medical providers who create the most costs in the system by a wide margin. And it's very, very true, which is why I think a lot of people don't know this is the case. So now, what are the hospitals doing to drive up the cost? Well, they use things like surprise billing. Now, surprise billing, of course, occurs when a person visits a facility that's included in their insurance network. Everyone knows what that is. But while they're there, they are treated by an out of network provider. So your hospital's in network, but the doctor you might get that day during their visit happens to be out of network. Sad day for you guys. It looks like you're just going to get a bill from the provider. He's out of network. What are you going to do? What are you going to do? Now, that massive bill, it turns out, is only a surprise for the patient. They know what they're doing. So, now one of the arguments made by the hospital industry against single payer healthcare is that, yeah, but okay, so if you reduce our revenue by tamping down on the costs, and that's the biggest thing Medicare for All brings to the table, other than, of course, ensuring everybody with superior health insurance through the government. Uh, well, it would reduce the costs, again, lower overhead, and be able to negotiate with hospitals to set prices. They say, well, if you do that, then we're going to have to close. Well, and so how do they base that on? Well, according to the American Hospital Association, Medicare only pays about 87% of the cost for caring for patients. So that 13%, I'm assuming, is being covered by the patient. Under Medicare for All, that'd be 100%, which is obvious. And look, maybe it's the patient, maybe it's supplementary insurance coverage. I'm not entirely sure. By contrast, private health insurers often pay hospitals 2 or 3 times what Medicare does in reimbursement rates. According to a study by the RAND Corporation, they found that Tenet hospitals on average charge private insurers 210% of what Medicare pays. Jesus, man. Look, that's where they get the profit. The insurance companies then will take that, will pay that, and they will pass down the cost to you, likely in an insurance markup. So now, these for-profit hospitals will also, by politicians while in office, hire them to be in the boards to say things like this. And this is a quote from Bob Kerrey, who is a former Democratic governor, by the way, and U.S. Senator from Nebraska. Now, he serves on Tenet's board of directors, and he had written an op-ed for the Omaha World Herald about Medicare for All. And this is what he said. Quote, he said it's a delusion. Really? He said that Americans long for a president who will ask us to pay more for the pleasure of increasing the role of the federal government in our lives. And of course, that's a very snarky statement there. So when you think about that, he's like, well, I doubt people will long for a president who will ask him to increase the power of government in our lives. Well, wait a minute. That's a Republican talking point. This guy's a Democrat. He sounds exactly like a Republican when it comes to healthcare. And look, he's not the only one. You've got Amy Klobuchar. You've got John Delaney. You've got all these establishment Democrats that despise Medicare for All. Why? It's because they're paid to do so. And now we know who funds them: the hospitals and the insurance companies and the pharmaceutical companies. And these hospitals don't want to deal with Medicare because then they won't be able to charge exorbitant prices for things like Advil. $2,000 for an Advil. $500 for a bag of saline. And here's the thing, right? This doesn't happen in the rest of the developed world. That's why they pay per capita half of what we do here in America, and yet are able to cover everyone under a universal healthcare system. Our system is incredibly broken, and that's why we need Medicare for All to fix it, because that's why we pay more than anyone else. That's why the hospitals are able to screw us over, and that's why they're fighting so hard against any sort of change to the status quo. Medicare for All, only way to bring down these costs. Not a public option, not a half measure, not Medicare Plus or whatever you want to call it, or Medicare for All X, or whatever plans the Center for American Progress come up with that isn't actually single payer. No, we have to have Medicare for All. We have to have single payer. We have to accept no middle ground. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.